Good morning, Flagler County. This is Danielle Anderson, your host of Lifeline, the radio show connecting you to positivity in our community. And we have Dr. Cascio in the studio this morning. Good morning.
Good morning.
I can't believe we actually have you in the studio and you're not like super busy doing like really cool things.
Well, every now and then, but I get some time off to interact with, non-patient people.
The general public.
Yes,
So, for people who haven't had a chance to meet you, tell us a little bit about yourself.
sure. I've actually been in the community for over 18 years. My office is located attached to Advent Health Palm Coast, and obviously I'm a plastic surgeon, which we will get into a little bit in a little while. But been here for quite a while. Do a large variety of procedures, helping the community and assisting patients.
So, I am going to ask you some really weird questions. I hope that's cool.
Absolutely,
I
the
love
weirder the better.
Okay. Oh,
Oh,
don't say
excuse
that
me.
now. Okay. So, how did you kind of get into this field? Because we always want people to get to know our doctors.
Sure. It was a long trek, starting in college and started to get interest in the sciences and such. Then it proceeded to med school. And while in med school, you rotate through multiple different specialties and subspecialties where I determined that I enjoyed surgery. I was always a doer. Just continuing down that trek, I did 5 years of general surgery. Was board certified in that. However, I never practiced in that. And once I completed my general surgery, I did, additional training in plastics. And, once I finished my plastics training, that's when I came to Florida, back to Florida, that is, because I did my general surgery at University of Florida in Jacksonville, and that's where I was familiar with this area somewhat. And one of my junior residents in general surgery was actually practicing here.
Nice.
And at the time, it was one of the fastest growing cities in the United States. No plastic surgeon here at that time. In addition, being from Louisiana, unfortunately, the Katrina thing happened in Louisiana. So, starting a practice at that time back home wasn't that appealing. Was going to be quite difficult, and considering the other information, I decided to come to this area.
That's really cool. Are you from New Orleans?
About 30 miles west, so small town called Reserve. You've never heard of it?
We just started exploring it a little. We actually went to. My daughter was born on Epiphany, and we didn't know that there was a. That's really the opening night for Mardi Gras. Is they do it's like a Joan of Arc parade through the city of New Orleans.
Oh wow!
And so we were like, oh, that's really cool. So you learn something new about Louisiana all the time.
Mm-hmm.
It's really amazing. So how did they get the name plastic surgery? Do you know?
Absolutely. This is a question I get probably once a month, if not more. It's actually derived from the Greek word plastikos, which means to mold.
Oh,
So
wow.
it's not artificial in any way. It's just, reference to a Greek word.
That's pretty cool.
Yeah.
So what is your favorite procedure to do?
Oh, wow. That's a difficult one. It's not a specific procedure. I think it's procedures where patients see the most change and improvement that I tend to enjoy the most. That could be something like a breast reduction. Many women are extremely happy after breast reduction because of the benefit, less pain, back pain, that's improved. Skin cancer, that's always a really big surgery, especially when you're dealing with some difficult cancers like melanoma. Patients are very appreciative after that. And those are the things that I typically enjoy. All surgery is challenging and rewarding. It's just, I think the patient interaction part is what I tend to enjoy the most.
That's really cool. I mean, I think some of us have this whole vision of Nip Tuck and that whole like series.
Thankfully, that's not accurate.
So you're like, oh my gosh, is that really what it's like?
No.
Like, no.
Well, at least not in this area. I don't know about Miami or, Beverly Hills. We'll see.
It could be. So I know you had a couple of things you really want to talk about that are kind of important that people don't know about. So let's jump into some of those.
Sure. One of the ones I wanted to discuss is breast implants.
Yeah.
Because it seems to be a topic that many patients aren't really that informed. As most people know, there are two general types of breast implants. There's silicone and saline. And there are some subsets of each of those. Saline implants really don't need to be monitored other than with a physical exam because, and I guess I should step back slightly and say all breast implants will rupture at some point.
Really?
They,
Wow.
they do not last forever, and that is something that every patient who has a breast implant or breast implants should be aware of. When saline implants rupture, you're going to know there's a problem because your body absorbs the water, your breast shrinks, and there's an obvious physical change. That doesn't happen with silicone breast implants. So back in 2006, when silicone breast implants were placed back on the market because there was a hiatus from 92 to 2006 because there was a concern that they were causing health problems in women, and they found no real significant association compared to the general population with their use. So in 2006, one of the stipulations or recommendations is that a patient with a silicone breast implant get an MRI 5 to 6 years after the implant is placed, and then every 2 to 3 years after that, simply to evaluate whether or not that implant is intact.
And so, what are they kind of finding?
Well, you still will find some ruptures, and as time goes on, you're going to find more of them. The difficulty is most women, you're not going to be able to tell on physical exam if there's a problem with your implant.
How do you not tell?
There's nothing you'll be able to detect on because it doesn't really change the breast if there's a rupture, because the majority of ruptures are going to be what's called intracapsular, and it progresses to an extracapsular rupture over time. And what that means is the capsule is the scar tissue that surrounds the breast implant. And when an implant ruptures, the integrity of the outer shell of the implant is violated, and there is silicone material outside of the shell of the implant, but it stays within that capsule or scar tissue. That's an intracapsular rupture. Over time, that intracapsular rupture can become extracapsular or go outside of that scar tissue, and that's when it becomes a little bit more significant because that silicone material can infiltrate into the breast tissue so that when that breast implant eventually needs to be removed, now you have to remove that additional breast tissue that is involved with that as well. So it can be a much more involved procedure.
Are there any other health implications as a result of that?
That's a great question. They're still doing a lot of research to determine whether or not silicone, especially ruptured silicone implants, cause any significant health problems in women. They really haven't seen any proof to say that that's the case. There are a few things that we will see that is more common with ruptured implants, such as capsular contracture. What that is back to referencing that scar tissue that surrounds the implant. In the majority of cases, that scar tissue is very soft and pliable. You can't really detect that it's there. But over time, that scar tissue can become hard and thick and actually calcify. So much so it can be as hard as like an eggshell or even firmer than that.
And as a woman, I think that would be really challenging, to know something like that.
Absolutely.
What's the shelf life on a breast implant?
There isn't any shelf life. Your rupture rate is somewhere, and it depends on the manufacturer, somewhere around 7% at 10 years. So it's definitely not something that is lifelong. And as your implants age, that rupture rate increases significantly. The old adage that people used to say about replacing your implants every 10 years, that's actually not the recommendation currently. The American Board of Plastic Surgery states that if you're not having any problems with your implants, you do not have to have them replaced. Now, that goes along with obtaining the MRI to make sure that your implants are intact.
Right.
One of the other questions that I'll typically get a lot is like, well, why do I need an MRI? I get my mammogram every year. Well, mammograms are fantastic for evaluating your risk for breast cancer. Unfortunately, they don't do a great job of evaluating an intracapsular implant or an intracapsular rupture. So that's why an MRI is recommended.
So are there ones that you would, I mean, do you have particular ones that you say, this is a brand that we prefer because we know it's
That's
safer,
a great
it's
question.
longer?
The majority of the implants are very, very similar as far as their rupture rate. We have on the market multiple different manufacturers, and then within each manufacturer, they have different types of breast implants, in that the cohesivity of the silicone is different from one implant to another. It will feel slightly more firm. It's kind of hard to explain exactly what that means, other than the silicone molecules are more tightly attached to each other. So if you have something that is more like jello versus something that's a little bit more solid, that's what you're going to be looking at from a cohesivity standpoint.
Now, if you wanted to do something like an enhancement, but you didn't want to go this route, is there any other option?
For breast enhancement?
Yeah.
Sure. It's much more difficult. One of the things that some women will do, and I don't do this surgery personally, is you can have fat grafting to the breast, where they will harvest fat from a different part of the body and then inject it to the breast to give some more volume and fullness. There is some difficulty with that, is anytime you do fat grafting, the volume of tissue that is being transferred, only about 50% of that volume on average will still be there at a year.
Because girls are having problems with the Brazilian butt lift thing, right?
Well, there are multiple problems that could happen with that surgery as well. That's yet another surgery I don't perform. But yes, there are potential issues with that. Probably one of the bigger ones, we're getting a little off topic here, but that they can have intravascular injection of the fat. So you can get a fat embolism, which could be, life-threatening.
Wow. So what else? What other exciting things do you work on? Like, this is just a total education.
Sure, not a problem. As I alluded to, I do multiple types of surgery. Surgery after weight loss, for instance, is something that I definitely have a passion for. It makes a very big difference in patients' lives. Patients who have lost 100 pounds, 200 pounds, and have this large apron of excess skin. It can really change their lives.
So how does that kind of work when you meet someone and say they're several hundred pounds over what they should be? How do you work with them to get them to where they're ready for surgery?
Well, the first step is obviously to lose the weight, and there are many ways that can happen, and I have patients take every single one of them. They can do it on their own, where they have diet, exercise, and decrease their caloric intake and lose the weight by themselves. Then there's always, gastric, bariatric type surgeries, where it really changes some of the gastrointestinal tract to decrease absorption or increase fullness by decreasing the size of the stomach. Again, those are typically done by bariatric surgeons. And then there are, weight loss medications that many people are on these days, the GLP-1s. All can contribute to weight loss. And the most important thing is once the weight has been lost, you need to maintain your lifestyle to maintain your ideal body weight that you would like. And once the patient has lost the weight, if we're going to do a surgery like a tummy tuck or a body lift or something along those lines, it's important that the patient be stable for 6 to 12 months before doing any of those procedures.
So they would lose the weight first and then maintain
Correct. Yes.
maintain that lifestyle.
Exactly.
And then talk about what goes into it, because it looks like it's a lot of, I don't want to say trauma on the body, but it's a lot involved, right?
For which surgery in particular? Any
So
of them
will
for
we see
body
folks-
contouring?
Yeah, when we'll see them where they have their arms redone.
That's a
their tummy,
brachioplasty.
their
Yeah.
legs, things
Sure.
like that.
Yeah, very common operations. It could be anything from a facelift to, mentioned arms. That's called a brachioplasty, where you have an incision that starts around the elbow, goes up to the axilla or underneath the arm and down along the chest wall a little bit. It improves that hanging skin in the upper arm. That one is typically a very easy surgery for
Really?
patient. Yeah, it typically doesn't cause much discomfort.
Wow.
It's an easy one to recuperate from. Then, we have things like a tummy tuck.
Yeah,
Everyone
yeah.
knows those. You have a hip to hip scar and a scar around the belly button. And that's typically allows us to remove tissue from right above the belly button all the way down to the upper pelvis. Really improves the lower abdomen. And while the tummy tuck is being performed, we also do what's called a rectal plication, where you have your rectus muscles on each side of the abdomen. So some suture is also used to bring those in horizontal fashion to kind of tighten that, which will improve a diastasis, which is kind of an outpouching of the muscular abdominal wall.
Are you kind of like building a six pack for them?
Well, if I can build a six pack, I would have one myself. So
Oh.
that's not exactly happening, but it does flatten the abdomen significantly.
That's amazing.
Yeah, and there are larger surgeries, like the tummy tuck. If you were to continue those incisions and excisions circumferentially all the way around, that's called a body lift or a belt lipectomy or something along those lines, where we can remove more tissue around the flank and the back of, especially
Wow.
important in those people who've lost, 100, 200 pounds, because the excess tissue is not always just on the front, it's on the sides and the back as well. So it gets a lot of improvement.
That's incredible. I mean, and I've seen some work done, not yours, but on TikTok and all those things, and you're just like, the way that it's just like a total
Oh,
transformation.
completely. And it really changes these patients' lives, because if you see the excess skin that they have, it's quite impressive. And unfortunately, it gets in the way. They can get rashes underneath because it maintains a moist environment there. So it really makes an enormous change.
So it's not just a mental health; it's like physical health as
Oh,
well.
absolutely. It improves their physical capabilities as well.
That's amazing. Okay, we're gonna take a quick break and we're gonna talk about some more really cool stuff. We'll be right back. Good. All right. All right. So we are back with Dr. Cascio, and we're talking about overall improvement of your health and how it can really, plastic surgery can actually be a life changer for you. So we were talking before also about breast things, and I was thinking when you lose weight, sometimes things are not as firm and muscular back where they should be. So what kinds of things do you do with that?
For breasts, absolutely. And the amount of change can differ from patient to patient, and it's really going to depend on the patient's age and their skin elasticity. Elastic skin is great skin. Once you have a volume change, if it's elastic, it's going to shrink. And if unfortunately the skin is not elastic, which happens very commonly, is you get droop.
Right.
So with that type of situation, there are a couple of options that the patient has. If the patient is still very large-breasted, we can do a reduction, get everything shaped a little bit more aesthetically pleasing, and bring things up to a more youthful position. If there isn't much size, then you can do a breast lift alone or combined with a breast implant if you want more size. So there are options that are available.
That's amazing. So it seems like the hottest fad on like Entertainment Tonight is a facelift where they're like pulling at a different angle than they normally do. Do you do that kind of work?
Facelift you're talking about? Yes, I do facelifts. Yeah, where a facelift will give its most improvement is going to be along the jawline and the neck, is where you're going to get the biggest change. A lot of people will have the misconception that a facelift is going to do something for the eyes or eyebrows, and it does not. You can do additional procedures that can change those areas, but the facelift is mostly going to improve the jawline and neck area.
So kind of make it like sharper and
Exactly. It improves what's called the cervical mental angle. So that the sharper that angle is, the better aesthetics of the face.
so as women get older, we get our necks get a little
Men too. Men too.
men too. Okay, a little less, taut.
Mhm.
So I mean, how do you work on those kinds of things?
Well, that's exact surgery that I was just mentioning. It's a facelift with extending the incision behind the ear a little bit more inferiorly, so you can pull the skin up and affect the neck in a stronger way.
So is it still where the facelift is in front of the ear and people have the little scars?
It's typically, and it depends on the amount of facelift we have to do. If you're going to do a mini facelift, then typically you only have something in front of the ear to down towards the earlobe. If you have to remove more skin or affect the neck in a strong way, then you're going to go behind the ear in addition to that and across and into the hair a little bit as well.
Wow. And so what are some of the other things that you can do? I mean, you're basically like a magician here.
Well, I don't know about that, but we were talking about body contouring legs as well. I performed one of those this week, where it was someone who has lost 150 pounds.
Wow.
So, in addition to some excess skin in other areas, there's a lot of excess skin on the legs. So I did a thigh lift on her. The negative about doing a thigh lift is scarring, especially on ladies, because if you have a lot of excess skin, the only way to really improve that is you have to extend an incision and subsequent scar along the inner part of the upper leg. That allows us to remove a lot of that excess skin and improve how the leg looks. Now, the scars on the inner part of the leg, it's not always visible. Obviously, it's not visible when you're looking straight on or looking from the back, but, as you're ambulating, walking, it can be visible there. It's kind of a trade-off.
Nothing a tattoo couldn't handle, right? Take care of,
Well,
right?
it depends on what size of the tattoo you want.
So do you also do like folks who have burns, things like that? Do you work on that kind
We
of?
don't really have a lot of burns over here. Most severe burns are going to be transferred to Gainesville because there's a burn center there. I do treat minor burns and such, but most of the major burns are going to be transferred to that center.
So what about things like maybe if you're in a car accident, scarring from a dog bite, things like that?
The difficulty with scarring is you can't erase scars. If they're poor scars, you can improve them, of which I have done that on multiple occasions. But there's no scar eraser, unfortunately, and there's no such thing as scarless surgery unless you operate in utero.
Oh.
So once someone is out into this world, if you're going to operate on them, there's going to be a scar. Now, their scars vary. They can be poor scars where they're thick or wide or red or dark. Or they could be exactly flesh-colored. So they come in a wide variety of options.
So has there ever been a case that was like a really big challenge for you and you were able to solve it and it was really great?
I get those quite often. Some of the difficulties would be, one that comes to mind is I had a patient sent to my office after having a cancer removed from his scalp by a dermatologist. And he ended up, when I saw him, he had a 5-centimeter defect on the top of his head all the way down the bone. So there was no tissue there, so I had to, close that up and ended up lifting up 3 advancement flaps, is what we call them, and brought it together to cover the defect.
Wow.
Kind of a big defect to cover that way, but he did very, very well.
That's incredible. And it's got to be rewarding when you see like the patient being happy.
Extremely. This is somebody that I typically will see every few years, comes in, still smile on his face, still wants to say thank you. And those are the ones that are the most rewarding.
That's amazing. And now, is there anybody who's not a good candidate for plastic surgery?
It's all about health. If you have severe cardiac issues or other significant comorbidities, that's really what is going to be the inhibitor for someone to have some kind of surgery. Age is not typically a factor. I've done surgery on patients in their 80s for cosmetic reasons.
Wow.
As long as they have good health, that's going to be the most important factor.
That's amazing. So if people want to find out more or schedule a consultation, how do they get in touch with you?
Sure, they can contact my office. It's 386-313-1982.
And it can be boys and girls that can call you.
Absolutely.
Well, thank you so much. I look forward to it. I know you can't share like your results and the before and after. Do you do that on Instagram? Some doctors do.
I do not post any patient photos online. If someone comes in for a consultation, they can see them at that point. Okay. But I don't want to broadcast it to the world.
That's nice. So it's also confidentiality. I love it. Awesome. Well, thank you, Dr. Cascio. We're looking forward to seeing some more of your work in the community, I think.
My pleasure. Thank you for having me.
You bet. We do want to thank WNZF News Radio, Flagler News Weekly, the Vigilante Philanthropists, Massage by Natalie and Company, and also the Benjamin Moore Paint Store here in Palm Coast for sponsoring.